If I'm a parent and looking at a treatment center, questions I want to ask would be something like, what's the size of the groups that my kid's going to be in? You know, how many um, patients are going to be there versus how many staff are going to be there. Certainly, you know, some kids just do better in a smaller, more intimate setting. Some kids might want more anonymity and not to contribute as much, although in most of those cases we should be pushing those kids to be doing a little bit more. You know, there's still certainly going to be a size factor, just like we think about with high schools or colleges, that's going to make the most amount of sense for the healing, you know, for your teenager. And so knowing that kind of sizing and ratio would be a great question to ask. A second one to ask would be kind of how often are you treating, you know, the disorders that my, you know, teenager is dealing with right now. You know, is this a regular part of things? You know, what percentage of the patients that you deal with have these disorders? I get asked those questions not infrequently by parents, and I'm always happy to share data and my experience with that. I think those are great questions, you know, for parents to be asking. Certainly, you can ask questions about kind of the overall treatment ethos and what a program is really trying to do. You know, there's a difference from a place that's saying, we're going to take a break from things and give you a whole bunch of skills and then get you back out there, versus a place that you're going to go and join a treatment community and work on, you know, helping each other and yourself get through recovery. And those are pretty different, you know, treatment models, and there's certainly some people who will do better with the former, certainly some people do better with the latter, but just making sure that you're being aware of kind of what that's going to look like as a parent. I think in some cases you can make sure you're clarifying, you know, how often is my teenager going to be seeing a doctor, how often are they going to be seeing a therapist, how often are they going to be seeing, you know, a dietitian, or how often are they going to be seeing a teacher, or any of, you know, the individual services that might go in to a treatment program. It's always nice to have an idea about what that looks like, and I get that question asked to me a lot as well.